You want to have all the public officials?
Yeah,
here?
everybody
To
needs to come
welcome
up.
the
Come on
governor.
up.
Congressman Lara, please.
Well, semi-spread out.
Yeah, a little bit spread out. You know, we have our masks on. You guys set? Set? Good. Well, Fran and I have been visiting a number of vaccination sites today and the last few days. Very, very impressive what's going on here. I think the county is going very well. I kind of looked at the numbers as we're coming in, driving in. Our numbers are usually a couple days behind, so it's probably a little bit more than this, but 18% of Hancock County has been vaccinated, pushing 14,000. And really impressive is the number of people 80 years of age and older who are the most vulnerable. Hancock County is doing better than the statewide average. Statewide average is about 67, and I think Hancock County is up to about 70%. So, very, very, very good. Fran and I walked around and talked to a number of the volunteers, and I just want to mention, throughout the state, we're seeing so many people who are volunteering, who are making these sites like this work and work exceedingly well, so that the experience for the citizen when they come in to get the shot is really a good experience. I think people are generally amazed at how it flows, how it works so very, very, very well. We are now on offense, and it's just great to be on offense with the vaccine. We're continue to move forward. We've got to stay on defense for a few more weeks and keep wearing the mask. But things are looking, I think, exceedingly well. Kareem, you want to just kind of give them an update of what's going on in the county?
Just really quick. I mean, I've been talking to them almost every day here, but
They're
just
sick of you again, are they not?
probably. I just want to thank the governor. It's a great boost for our staff here, for our citizens who are considering the vaccine, and I want to thank him for keeping us safe and protected here. We're getting more vaccines, as you're all aware, starting last week, and we're giving them more. So, Governor, you keep saying that we're almost through this. We have to hang on to our mask, please. Distancing, and literally, you can see the finish line. It's right there.
Finish line's here.
Yeah. So I want to thank all our partners, the hospital, University of Findlay, the mayor, the commissioners. You heard a lot probably about the Findlay and the Hancock Way. You see it all under one roof. So welcome to Findlay, welcome to Hancock, and thank you for your leadership. Yep, thank you.
The commissioner and I talk every Monday morning, 7:15, right? Every Monday morning. We've been doing that for close to a year or so. It's been quite an experience. We're happy to answer any questions. Anybody's got questions?
Governor, you've said that once we get to that 50 per 100,000, we look at health orders. Are we looking like we could be on pace to do that before the summer?
Yeah, I think the summer is going to be great. We have to continue to get vaccinated. We have to continue to wear masks for a while. But we set a target of 50 cases per 100,000 population statewide over a 2-week period of time, and that's it's kind of a standard measure. We've been showing every press conference I've held, we show that measure, and we are dropping. I mean, we're dropping very well. It continues to drop. I can't predict what the future is going to be, but if we stayed on the current course, we would hit that 50 in about 7 weeks. So, as we look towards county fairs, as we look towards festivals, as we look to the summer parades and baseball games and all the things we want to do, there's no reason we're not going to be back to normal this summer. But we're not there yet. We're driving like a football team. We're down to the 5-yard line, and we just got to keep going. We can't walk off the field now, so we got to continue to wear masks, and we got to continue to work very, very hard to get every citizen in the state of Ohio who wants the vaccine to be able to do it. And you know what Hancock County is doing, where you can literally pick up the phone and call, and they will schedule you an appointment, is really makes it easy for citizens to navigate this. And this is really the very, very important thing. So we hope that people will continue to get vaccinated. One of the things that I'm noticing is some people who early on did not want to be vaccinated and said, no, let's hold back on that. Now they see some friends getting vaccinated, and they're hearing more about what's happening across the country, and they feel good about it, and they go in and get vaccinated. For Fran and I, I'm 74, she's 73, so we got our shots the same time, and about 2 weeks, a little over 2 weeks ago, we got our second shot. So now, 2 weeks into this, we feel good. We feel we can go out and travel the state. We're in 4 different communities today, going to different vaccination sites. We started at home in Cedarville, and we went to Greenville, Dark County, here in Hancock County. From here we go to Maumee. From Maumee we'll go to Marysville. So you just kind of want to see exactly what is going on, how things are working. One of the questions I talk to the health commissioner about, and we talk everywhere, is when do we move the numbers again? When do we open this up to the next group of people? And these are difficult calls, because you want the vaccine to be flowing out. You don't want any of it sitting anywhere. At the same time, you want people to be able to navigate once their turn and be able to get the vaccine. So we'll continue to assess this, and it will not be too long until we're down into people who are 40 years of age and older. Anybody else?
You've been traveling around to all these vaccination sites, and next week we're going to be opening up the mass vaccination sites in Cleveland and Cincinnati, and we're about to pop up sites here. What's your first impressions when you go around to all these sites and see all these Ohioans getting these vaccines?
Well, this is a great thing. This is the happiest I've been for a year, and and it's great to see people come in. And look, when you talk to people, there's just a sense of relief. People who are getting vaccinated, there's a sense of relief. I can go about my life now. I got to be careful, but now I can start seeing my grandkids. Now I can start doing what I want to do. I mean, literally, we talked to some of the volunteers, some of the nurses. They said, look, when we opened this up and 80-year-olds were coming in, we had 80-year-olds, 85-year-old, 90-year-olds who said, I've not left my home for a year. I've not seen my grandkids for a year. So it's been a tough year, but the sun is out in Hancock County, and we're moving forward. Anybody else? Yes, sir.
You touched on this a little earlier, but do you have anything to say for the people that are still holdouts on, concerned about getting the vaccine? Anything to say for the people that are still on the fence about it?
I think the best thing, if people are wondering about whether they should get a shot or not, if they have a doctor, a healthcare provider, talk to your doctor. That's really the best thing. Talk to somebody that you trust. I think also that as more and more people get vaccinated and we begin to know a lot of people who've had their vaccination, that's a comfort level. No one wants to be really first, but now we've had millions of Americans who've been vaccinated. And so the experience level is there. It's a real opportunity for people to see what's going on. So,
thank you.
Anybody else here want to say anything? Congressman? Come on, Congressman.
Well, first, to the Governor and First Lady, welcome to the 5th. In my dad's home county.
Home county.
But, one of the great things we can talk about this morning is we crossed that threshold in this country, 101 million vaccinations as of this morning. And when you look at these numbers over the weekend, we should be over 105, 106 easily by Monday morning. So we're really watching these numbers exponentially go up now. So it's really looking good. And when you look here in the state of Ohio with over 1.2 million, so those numbers are going to go up. We're going to see more and more of the vaccines coming out. In the early stages, being on Energy and Commerce and meeting with the Vice President and that team that came together to make sure that we could get this done. This is the amazing thing. In 9 months' time, never before, The FDA came out with the emergency use authorizations to make sure we could get this done. So, we're going to make sure that we got the vaccines out there for all Americans, and so it's coming quickly now.
Do you feel that even more federal government approval for other things will help keep this process going and make sure that we don't fall into the same thing that the pandemic hit us with?
Well, if you're saying if we're going to have more of the vaccines out there, yeah, I really believe that we're going to have the vaccines. One of the things, I've been going across the district and talking with our health commissioners. I was over in Henry and Defiance counties yesterday, and it's really making, the great thing is if people want the vaccine, they're lining up now. And so many more people want to have it. So I think it's important that we get them out to the counties, and so that these people can get vaccinated.
You guys are a part of the circuit going around the state. What are you guys learning? Because it's not every day you get to be out in the field and be a part of these clinics. What do you learn from local leaders in the city or county level?
Well, one of the things that, again, is talking with the health commissioners and with the hospitals. That's who we're meeting with. And so I've got 14 counties, and so I'm going and talking to everyone. It's making sure that one of the things we've been hearing is making sure that everybody knows who's got the vaccines. And so we want to make sure that people know where they are. But again, we want to make sure we get as many vaccines out because, again, I think that, as the governor said, I think that as more and more people find out, you talk to your doctor, you talk to your friends, more people are going to find out that they want to get the vaccine. And, it reminds me years ago, something like this is back when people were worried about polio. So first you got your polio shot, and then I remember as a kid, we all went to, to a school on a Saturday afternoon and got a sugar cube for kind of your booster for your polio. And so the communities all turned out. And so I think that, the coordination here with the university and with everyone else, with the health department here in the county has been tremendous. And so this is, we're going to see so many more people at the end of this day have that vaccine, been vaccinated with them. Yeah, thank you.
Mayor?
Good afternoon. I was just going to say that I think it's important to also remember that, as we said, we still have a lot of precautions we have to take. And though we're starting to get our communities vaccinated to be able to reopen, there's also the other aspects that we're going to have to work through with the economic recovery, the mental and emotional turmoil that everyone dealt with over the past year. And so I think it's important to also remember that, get your buddy to go get vaccinated, but also make sure you're reaching out to your neighbors and community members so that we can help them recover throughout the from this pandemic. And that Hancock County has a lot of resources for our citizens. And so make sure to reach out so that we can help you because we want everybody in our community to get vaccinated. We also want everybody to be safe and well and be able to get back on their feet as we move into this next year. So thank you.
I just add one, just a couple figures. We've vaccinated now about a fifth of the people in the state. If you look at first doses, we're about 2.3 million. Yesterday we had yesterday numbers that came out, and they come out around noon. So I don't have numbers for yesterday, but for the day before numbers we set a new record. There's 84,000 first doses. That's the most we've ever had in one day in the state. So very, very happy about it. Mr. Commissioner, so if someone wants the vaccine, if they're 50 and over, or they qualify in one of the medical, what do they do?
They call our number, 419-424-7105. We have a bank of about 10 phone people manning the phones. They will help you through the process. They will send you stuff by email if you do email. We want to make it as easy as possible. So this is progress.
So as of right now, they could probably get shot next week if they qualify?
We have clinics, absolutely. If they qualify, we have clinics all through next week. We have clinics the week after. Every Wednesday, we learn how many vaccines we're getting from the state. We sit down with our partners at the hospital and figure out how we want to distribute those. We want to slow the spread and save lives, like the governor wants us to do. So we're moving them as quick as we can.
Madam President, say something. Come on. You're our host. Come on.
Thank you, Governor and Mrs. DeWine. We are honored at the University of Findlay to welcome our special guests and certainly to offer up our space for this worthy cause. It's our honor to do so. It is this kind of community support and collaboration are key to not only the success of the University of Findlay, but for all our citizens. So I look forward to continuing this strong collaboration, of course, but I hope it's not in a crisis situation. Thank you.
Commissioners, anybody?
May I say something?
Oh, yeah.
Thank you very much. Thank you all for being here. I really appreciate it. On behalf of the hospital and the hospital leadership, we have worked really hard, not only with the Hancock Public Health, but also with our partners at University of Findlay, getting all of the volunteers here, and we're so happy that everybody was able to come here to get their vaccine, and we look forward to being able to continue this vaccine effort with our partnership here within Hancock County. So again, thank you very much. Thank you.
Thank you.
That's good.
Commissioner? All right.
Well, thank you all
Thanks,
for
everybody.
coming. I think we're good.
Thank you, Governor. Appreciate it.